uh, let let us all know what are the advantages of regular health checkup, that too right from the school age. Like, in the initial years till 18-20, we do not take health that seriously. Later on we start thinking, no, after 40 or 50 we have to go for regular health checkup. But with this policy we have to check our health or monitor our health, in the proper word, right from schools. So what are the advantages of it?
Yes, ma'am. So, as you correctly said, that we have always been neglected when it comes to our children's health, nor like we are not too fond of this preventive health checkup kind of a thing, or no, you go out and do an annual checkup. It's been now these days, like when you enter your 35, 40s, that time you actually realize the importance of it. But in a child's life, it is very important because when the child is in a growing phase, any no each and every organ of him like is developing, is growing, and whenever no you actually identify a disease or a condition at the earlier stage or at earliest, it's very easy to rectify it. That's the real benefit of it. And an ideal normal checkup should be done. So if we say, the government says that there are certain parameters based on which the school health checkup must be done. So there is a guideline given by the government through which parameters are given, and that checkup must be done. And today it's very important for us to do, because as we see, most of the parents, they both are working in today's time, because as we see schools and everything, all costs are increasing, both of them are working. So the problem what happens is, now we never take our child to a doctor just for a normal visit. We only take him only once he is actually ill or he is not feeling well. And many a times there are various conditions which the child himself doesn't know that he is facing. So for example, if we say, if the child is unable to see, no, he goes to a school, he is sitting on a bench and he cannot actually read what's written over there. So what happens is that the child doesn't know, is it a problem or this is normal. And when that child actually faces problem, he feels or he gets an headache, and that's the time when it's really very late that you realize, okay, you get a number checked and that student actually has a number. There are various other conditions like heart conditions or asthma cases also that have been seen. And one commonest thing what in girls we actually see in student children or most of the children, the level of hemoglobin is always low. If we see anemia, so according to a government survey only, 76% of the total students are anemic in our country. And the major thing is that there is no actual measure that's taken to actually check this and to determine this, because we always talk about mental health, but in a child's life or in his journey, many physical issues also add up to this mental issues what he is facing.